Welcome. Come on in. This is the Occupational Assessment Center. I'm Russell. I'd like to take a minute to show you around if you would like. This is where we're doing both assessment and treatment. If you come this way, here we'll do initial exercise routines with people to look at strengthening of general core stability, flexibility, and strength. Every one of our treatment programs would consist of some form of exercise. This is Bob. He's one of our simulators. He is a simulator for nursing where after doing any exercise, if our patient is in the nursing industry, a care aide, then we would have her do actual patient care. Come on this way. This is our VR, our virtual reality room. We're one of the only clinics in British Columbia that is incorporating virtual reality for assessment and treatment purposes. We're using the HTC Vive, which creates a three-dimensional environment within virtual reality for a patient. And during assessment, we may use simulators like the driving simulator here that gives us three-dimensional movement. We may also not have this room empty and we can do other job simulations such as bartending or crane operating. Come this way. In here is our open assessment and treatment area where we incorporate simulators, work simulators and training simulators into the assessment and treatment process. Our patients are typically equipped with a clinical motion capture system, which is recording and capturing all of their movement, all of the activity they're performing. And then after either they do their exercise or during an assessment, we would put them on an appropriate simulator. If our patient was a heavy equipment operator, for example, this is an excavator and would be the same physical demands of an individual doing the job of an excavator operator. Our patient here, John, is a front-end loader operator, and he's using the front-end loader in order to increase his tolerance specifically for his job. These simulators would be used throughout the day. The person would be on and off, integrating both exercise and simulation into increasing their tolerance for a full day. If it's for assessment purposes, we would do the same thing. We would intersperse simulation with standardized tests of flexibility and mobility so that we can track whether or not a person is capable of returning to their previous job. And throughout the day, throughout the clinic, the person is free to move around. They're moving from exercise to simulation and work, and then back to exercise again. We'd like you to join us. We hope you've enjoyed our clinic. Take a look at it. Look at some of the other videos available to you. Thanks.